Here we go. Question number 16. Another good old select all that apply. The nurse, the RN, and the licensed practical nurse, the LPN, are caring for a client with ulcerative colitis. Which of the following activities would be appropriate for the nurse to assign to the LPN? Select all that apply. LPNs. Now you need to know what you can and can't do, right? Can you monitor the client's bowel sounds? Can you remind the client to track their daily weight? Can you administer a rectal suppository to the client? Can you obtain the client's vital signs during a blood transfusion? And can you discuss the client's dietary modifications with the dietitian? What are we thinking? And the answers are 1, 2, 3, and 4. All right. 1, 2, 3, and 4. Ulcerative colitis is a chronic disease characterized by inflammation and ulcerations in the large intestines and resulting in abdominal pain, fever, fatigue, and frequent bloody diarrhea. Frequent diarrhea may cause weight loss and electrolyte imbalances. Therefore, the client should be taught to measure daily weights. Clients with UC typically have hyperactive bowel sounds. Blood transfusions may be necessary depending on the severity of the symptoms. The registered nurse cannot delegate tasks requiring clinical judgment, i.e. initial teachings, assessment, planning, and evaluation. However, the licensed practical nurse can reinforce teaching and monitor clinical findings after initial teaching and assessment by the registered nurse. They can administer medications via most routes, including topically via the rectum, so the suppository, and they can monitor the client for adverse effects during a blood transfusion after the initiation by the RN. Question 17, the nurse is teaching a client who has a new prescription for risperidone. What's risperidone, ladies and gentlemen? Part of pharmacology, right? Which of the following statements by the client would require follow-up? So what did my patient say that was incorrect? That I'm just like, whoa, playboy, hold on. We need to have a conversation. So is it number 1, I will contact my healthcare provider if I have a fever or muscle stiffness. I may become shaky and restless when I am agitated. I may sleep more often when taking this medication, or I will try to change positions slowly. What are we thinking? The answer is number 2, second generation atypical antipsychotic medication. Risperidone is one of them, is used to treat schizophrenia, bipolar, and other mental health disorders like, extrapyramidal symptoms are an adverse effect of these medications and include akathisia, right? Which is restlessness and fidgeting. Right, Parkinsonism, which is tremors and shuffling gait, and tardive dyskinesia, right, which is lip smacking and facial grimacing. These symptoms are important to monitor because they may be easily mistaken for agitation or negative schizophrenic symptoms. Most minor symptoms may be managed with a decrease in dosage or change in medication. The healthcare provider may prescribe anticholinergic or benzodiazepines to treat extrapyramidal symptoms. All right, here we go. Question number 18. The nurse is talking with a staff member who states, my client has a history of substance use disorder and constantly requests pain medicine. I just administered normal saline instead of morphine because it is too early for another dose of morphine. Which of the following action should the nurse take next? Is it 1, report the incident to the faculty ethics committee? Follow facility protocols for completing an incident report, instruct the staff nurse to document the incident and notify the unit manager, or instruct the staff member to notify the healthcare provider about the client's uncontrolled pain. What are we thinking? And the answer is number 4. The answer is number 4. Administration of a placebo, a substance with no therapeutic effect outside of the consent research trial, is unethical and deceitful. When faced with an ethical dilemma, the nurse should address the client's needs prior to reporting or documenting the unethical behavior. Clients with a history of substance use disorder and increased opioid tolerance often require a higher dose analgesic, I was about to say, it don't even matter, or stronger opioids such as hydromorphone, right, to achieve pain relief. The priority action by the charge nurse is to instruct the staff member to contact the healthcare provider to discuss the client's frequent requests for morphine to alleviate uncontrolled pain. Question number 19, the nurse is caring for assigned clients. The nurse should first assess the client who had a blank. This, ladies and gentlemen, is a what question. It's a what question. You tell me. It's a what question. All right. So, oh, brother, no, it's NCLEX, miracle, Lord have mercy. Come on. Is it a subdural hematoma 36 hours ago and is requesting breakfast? A transischemic attack 2 days ago and is scheduled to receive aspirin? Is it a stroke, is receiving TPA therapy and a GCS score that has changed from 9 to 13? Or is it a bowel resection, is receiving parenteral nutrition and had 4,800 mLs of urine output over the past 12 hours? So this is a prior, Lorna, you are correct. This is a prioritization question, management of care question, delegation, supervision, assignment, largest section on the NCLEX exam. So what's expected? What's not expected? What's acute? What's chronic? What's stable? What's unstable? All right. What are we thinking? And the answer is number 4. Parenteral nutrition is an IV nutrition solution containing glucose, protein, lipids, vitamin, minerals, and insulin. Clients with gastrointestinal tract dysfunction who are unable to tolerate enteral feeding methods are often prescribed parenteral nutrition. Glucose is a primary component of PN solution. Therefore, the nurse should monitor blood glucose levels and assess for signs of hyperkalemia. Those signs and symptoms are polyuria, polydipsia, polyphagia, headaches, blurred vision, right? Severe hyperkalemia can lead to seizures, coma, and death.